Hi, my name is Nicole Simpson, and I am doing an SBAR skills report on DKA. So in the situation, the in room 1, we have Mr. Williams, a 20-year-old male patient who is experiencing sudden thirst, deep breathing, increased respiration, fruity breath, fatigue, dry skin, dizziness, and has been urinating frequently for about 2 or 3 days, and a friend drove him in. Background: he's a college student diagnosed with type 1 diabetes 2 years prior. The patient had a major test in which he was stressed out, and after the test was done that evening, he went to a party. The assessment: patient is alert times 3. He's orthostatic positive. His blood glucose level was 531. His skin turgor is more than 2 seconds. He has urine ketones present in his urine. His ABGs show that he may have metabolic acidosis. He has polyuria, and his potassium levels are elevated. For the recommendation: lactated Ringer's fluids to start. We want to give normal insulin and check hourly. Check vitals frequently. We want to recheck the potassium blood levels and get a potassium order on hand if he has a severe rebound effect from it. Also, to get diabetic education and nutritional education and possible admission. Thank you.